Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the pharmacoeconomics, the term coined by the Townsend in 1986, which is a branch of health economics, making choices between options when there is the scarcity of resources, fundamentally comparative weighing the cost and benefits of two options, most efficient. Pharmacoeconomics, the description and analysis of the cost of drug therapy to healthcare system and the society. Pharmacoeconomics research identifies, measures and compare the cost, that is resources consumed, and the consequences, that is clinical economics, humanistic, of the pharmaceutical product and services. PE analysis, that is the efficient allocation of the limited resources among competing alternative medication and services. Biggest bang for your buck using a quantitative measure to make the best use of the limited resources. Why the study pharmacoeconomics helps to decide which drug to develop, to estimate and understand the full impact of new therapy, to make an informed decision regarding appropriate use of drugs which have been developed, to make the best use of limited resources. Next is the goals. To determine which healthcare alternatives provide the best healthcare outcome in terms of money spent, and to improve the allocation of resources for pharmaceutical products and services. Pharmacoeconomic input cost provide the healthcare system and pharmaceutical products analysis the outcome. So these are the pharmacoeconomics input cost versus price. Cost involve all the resources that are used to produce and deliver a particular drug therapy. Next is the types of cost. Direct cost, medical versus non-medical. Indirect cost, intangible cost, opportunity cost. There are the types of cost. Direct medical cost, cost of medical services. These include fixed cost or costs that do not vary immediately with the number of patients treated. Examples are the capital cost of hospital building or equipment, etc. Next is the variable cost or costs that vary immediately with number of patients treated. Example, cost of the drug, syringe, needles, etc. The direct non-medical cost, that is the cost incurred by the patient in receiving medical care. Examples are the transportation to and from the hospital. Next is the indirect cost. Example, income lost because of the absenteeism, loss of productivity. Intangible cost of the pain, worry and other suffering which a patient or his family might suffer. Next is the opportunity cost, the amount lost by not using economic resources in its best alternative use, labor, capital, building and management, etc. Resources invested in one area will be at expense of loss of another opportunity. In today's class, I discuss about the cost, type of cost, and the goal of the pharmacoeconomics and why I study the pharmacoeconomics. Thank you.